internship. Came down to Bangalore for a few months. That was a very interesting time, actually. 2003, I don't know how many of you guys might be kids, actually, so I don't know if you remember those days. There's a lot of change happening in India. I had left India in 2001, came back first time in 2003. And just the sheer amount of, when I left, mobile phones were supposed to be a sort of a luxurious kind of a thing to have. So I joined Google R&D. I liked my work, so joined it full time, and that's when a lot more of soul searching started happening as to what do I really enjoy. I like tech stuff. I'm still a sort of a geek or a nerd somewhere, but what do I really want to do, which has that engineering challenge for me, but at the same time has the kind of impact that I'm looking for more immediately. Started dabbling with a lot of NGOs, spent a lot of time teaching children. I mean, I got to tell you this. I know it's not really related to what I do right now, but you could explain science in a lot of fun ways, and I think Dr. Arvind talked about it earlier as well. But you take a piece of paper, blow air on top of it, it comes up, and something as simple as that you could use that to explain science. Similarly with health, there are a lot of things you could do in technology space to make healthcare more accessible. So started spending time with NGOs, trying to figure out what I could be doing, and realized I couldn't be making a half-hearted effort about it. I could not be doing a more typical corporate job while weekends go and sort of weekday evenings to spend some time doing that. That's like sort of you're fooling yourself doing that almost, or so I think. So there are two traditional, I'll digress a little bit. So when you talk of this real life, you have if we were to take a very black and white picture, there are two kinds of people, if you ask me. The people who want to make money, and what's the other kind? People who want to help others, right? And what do people who want to make money do? Sorry? Somebody said something? So you join a corporate job, maybe an investment banker or a consultant, and or you start your own company. And what does the company do normally? You identify where you can make money, and then distribute, right? And make more money. What do people who want to help others do, or should be doing? You join a non-profit, you join an NGO, or you actually work for free almost. And NGO world is also pretty rich. There are a lot of things you could be doing. You identify a problem you want to solve. You solve the problem, and you raise the money to solve the problem, and then you solve the problem, and then you keep on looping. So programmers around here would know what looping means, right? Fair enough. So if I wanted to do something which has more impact, I might start an NGO. But there was an issue, which is people have talked about it earlier. There is good amount of charity and philanthropy around, but it's still not enough. So if you look at the total budget of NGOs in India, there are lots of them, by the way. There are about, I don't know, a few 100,000 or something NGOs in India. But the actual amount that goes to charity is only about 3 rupees per person per year, which is not quite enough. I mean, 3 rupees won't even feed him. Clearly, charity as it is not enough. Ajay also talked about how to really make development viable, you have to create value. So can you make NGOs make money and use that to fund their work? And that was the theme that you were looking at. So that was sort of a genesis of where I wanted to be back in April 2008. So it's close to 3 years now. The funny thing about so most of you are students, right? So you might be spending a lot of time studying and so on, but really I think if you ask me the real value that you will take on when you move from when you finish off your education is not necessarily the technical content, but the network that you build here. Funny thing about technology today is that you sneeze here, if you think of something here, chances are friends in a different part of the country or even different part of the world will find out that you are thinking of something, and let's see if it matches my interest. Something like that happened with I and a couple of my batchmates, again, computer science scientists as well, computer science from my batch, IIT Kanpur. These two guys, a lot of you might have aspirations to be a placement time, probably. Placement time, you would probably be targeting the consultancy companies, the McKinseys and the KPMGs of the world, right? These two were we're in that category. But the funny thing about being a consultant is you always get to advise. You never really get to implement. And probably after a while you get tired of it. I mean, you're asking this guy to do something, and he does something else, and there's not much you can do about it, only shout at him, probably. They had a similar situation. They were working with client companies. They had asked them to do stuff. They got tired of it. They said, like, fine, I mean, let's just do stuff ourselves. And we said, fine, let's do something. Nothing much to lose. Well, yeah, much to lose, but who cares? So if you look at health sector per se, and again, Trisha would know this pretty well. So there are a lot of hospitalization events by itself, by themselves, are a big cause of poverty. I've seen places in India. If you go to Rajasthan, you see places where people take loans at as much as 1% a day, 1% a day. Imagine that's 360% a year. And most of these loans are for funding hospitalization cases. And some data, 2 crore people, 2 crore, that's 20 million people go below poverty line every year in India for hospitalization events. So we said, fine, we want to insulate people from these hospitalization events, ensure that they have access to this, access to funds to cover these things. And two, we want to reduce the basic cost of care. And in everything we do, we want to, India is so different, different parts of India are so different. Whatever solution you do, I mean, you do something for Delhi, it doesn't really work in Bangalore. So whatever solution you offer has to be very customized as well. And because we are a social business, we didn't want to work on charity necessarily or fully. So anything we do, we want it to be financially sustainable. So those were like the underlying principles of where we started in June 2008. I won't go into the details of the business model that we have, but mostly active in Maharashtra right now, in 4 districts, covering about 240 villages, and have funded about hospitalization for about 25 lakh rupees, funded about 500 hospitalization cases. Right, so I'll talk about a little bit about what our beneficiary profile might look like. So for example, this is Karad. So one of our beneficiaries, for example, what he has in hand is an ID card that we give him for membership in our scheme. So I'll talk briefly about what our scheme might look like. Sort of like a health insurance plus like scheme. For a family of 5, it may be something like 750 for a year. You become a member. All of your hospitalization up to a certain limit might be taken care of, and will be taken care of, and then you get 30% discounts on drugs and consultation wherever you go. So this guy, for example, he had a case of TB. The entire treatment of 3,700 was covered in a cashless way, and yeah, he gets more benefits and doctor visits as well. So the other thing to hold in hand that he has in hand, if you notice, the other card is some government. It's not very clear, but it's a government health insurance provided health insurance scheme for the BPL. When government is doing a lot of things for the segment as well, especially for health, but somewhere there are a lot of gaps in the way it's delivered, because of which people end up going to private sector a lot more. We have these community health workers. So there are still parts of India, and I don't have to tell you this, there's still parts of India where there aren't enough of community health workers, or there aren't enough of doctors. And so what we do is, to ensure access to low-cost care for people, we train these community level, we identify women in the villages and then train them on basics of handling some common conditions. The other thing we do is a lot of health camps, where we offer free services, free consultation services, and then discounted drugs. And these health camps these health camps are still viable, by the way. We are not doing it as a charity. So I think I'll just briefly talk about the challenges. So we've built a social business, we're building a social business. We haven't made it completely financially viable. But what are the main challenges? One is, any social business that you make, you got to get the people to pay. And that's hard. This is sort of a filter that you have to go through when you have somebody, social business has to target needy beneficiaries. Only a few of them have a lot of income, have enough income to sort of pay for care. And even fewer of them are willing to pay. So obviously you have to make something which is interesting to them. At the same time, you have to reach them at the right price as well. And if the people with economics background will say that it's about market creation per se. That's the first challenge. But the other challenge is when you're running a social business, you have to always keep the focus aligned. It's tempting to pick up other things which are financially a lot more lucrative as a business to run. But how do you handle that? But the last thing I want to close with is that while we talk about social business as something very different, it's not really that different at all. At the end of the day, the kind of things that you do are the things that you would be doing in a normal business. You talk about, it's about getting things done. It's about ensuring that whatever plans you have made, they're done at the right time. It's about finding a solution through problems. So it's not really that different. All you have to do is you have to just take a leap per se. Be ready for a hard life. It's always, you expect a lifestyle cut when you make a change. I did. So, and yeah.